Question 1. A newly hired sterile processing (SP) technician is assigned to the decontamination area. They are currently wearing facility-issued scrub attire, a face mask, and shoe covers. To fully comply with Occupational Safety and Health Administration (OSHA) standards for handling blood-borne pathogens, which of the following mandatory items must they add before beginning work? A. A sterile surgical gown and standard examination gloves. B. A fluid-resistant covering with sleeves, goggles, or a face shield, and heavy-duty decontamination gloves. C. A semi-restricted area coverall and sterile latex gloves. D. A heavy-duty lead apron and utility gloves. Correct answer B. Knowledge point explanation. Core rationale. In the decontamination area, SP technicians face a high risk of exposure to blood-borne pathogens from contaminated instruments. OSHA regulations mandate the use of personal protective equipment, PPE, that prevents blood or other potentially infectious materials from passing through to reach the employee's work clothes, skin, or mucous membranes. This necessitates a fluid-resistant gown with sleeves, eye protection, goggles or face shield, and heavy-duty gloves to prevent punctures. Trap analysis. Option A is incorrect because sterile gowns are designed for the operating room, or not the decontamination area where fluid resistance against gross soil is required. Standard exam gloves do not provide sufficient puncture resistance. Option C is incorrect as semi-restricted area coveralls are not standard PPE for decontamination, and sterile gloves are unnecessary for dirty instruments. Option D is incorrect because a lead apron is used for radiation protection, not biohazard exposure, and utility gloves alone do not provide full mucous membrane protection. Concept extension. The sequence of removing PPE, doffing, is equally critical. To prevent cross-contamination, gloves are removed first as they are considered the most contaminated, followed by face shields/goggles, gowns, and finally masks. Question 2. An SP technician is preparing to transfer from the staff break room to the clean assembly and sterile storage area to pack instrument trays. The technician has a short beard. According to Association for the Advancement of Medical Instrumentation, AAMI, guidelines, what specific attire protocol must be followed? A. Don a dedicated facility scrub suit, a head cover, and a mustache/beard cover. B. Wear personal street clothes covered by a buttoned lab coat and a head cover. C. Don a sterile surgical gown over scrubs and wear a standard face mask. D. Thoroughly wash the beard with antimicrobial soap instead of wearing a cover. Correct answer A. Knowledge point explanation. Core rationale. The clean assembly and sterile storage areas are semi-restricted zones requiring strict environmental controls. To prevent the introduction of microorganisms and particulate matter into sterile trays, AAMI guidelines require all personnel to wear clean, facility-provided scrub attire and completely cover all head and facial hair, including mustaches and beards. Trap analysis. Option B is incorrect because street clothes are never permitted in the clean assembly area as they carry environmental contaminants. Option C is incorrect because sterile surgical gowns are exclusively for the sterile field in the OR, not the assembly area. Option D is incorrect because washing hair does not stop natural shedding of skin dander or hair follicles, which requires a physical barrier. Concept extension. Head covers must be donned before scrub tops to prevent loose hair from falling onto the clean scrubs during the dressing process. Question 3. According to AAMI standards, what is the minimum required attire for an SP technician entering the operating room, or procedural area to perform support duties such as delivering a sterile instrument tray? A. Street clothes with shoe covers and a fluid-resistant face mask. B. Clean facility-issued scrub attire, a completely enclosing head cover, and a mask if open sterile items are present. C. A full sterile surgical gown, sterile gloves, and a face shield. D. A heavy-duty decontamination apron over scrubs and standard examination gloves. Correct answer B. Knowledge point explanation. Core rationale: when an SP technician enters the OR for non-scrubbed support roles, they must adhere to the dress code of a restricted area. This includes wearing facility-issued scrubs and a head cover. A surgical mask is additionally required if there are open sterile supplies or if a surgical procedure is in progress to prevent respiratory droplet contamination. Trap analysis: option A is incorrect because street clothes are strictly prohibited in the OR due to the risk of introducing external pathogens. Option C is incorrect because full sterile attire is only required for the surgical team physically operating within the sterile field, not for support staff delivering items. Option D is incorrect because decontamination attire is highly contaminated and must never cross into clean or sterile zones. Concept extension: traffic control in the SPD is divided into unrestricted, street clothes allowed, semi-restricted, scrubs and head covers required, and restricted areas, masks required in addition to scrubs and head covers. Question 4. A newly certified technician questions why they cannot wear their personal winter sweater over their scrubs in the prep and pack area when the temperature drops to 68 degrees Fahrenheit 20 degrees Celsius. What is the primary infection control principle behind prohibiting street clothes in the work areas? A. Personal clothing can generate excessive static electricity that interferes with biological indicators. B. Facility-issued scrubs are specifically treated with harsh chemicals to repel all bacterial spores. C. Street clothes can harbor and shed environmental microorganisms and particulate matter into the controlled SP environment. D. Personal clothing increases the body temperature, leading to excessive sweating and dehydration. Correct answer C. Knowledge point explanation. Core rationale: the SP work area is a controlled environment designed to minimize bioburden. Street clothes, including sweaters, coats, and jeans, are exposed to the outside environment and act as fomites, harboring millions of environmental microorganisms and shedding lint. Removing street clothes and wearing strictly facility-laundered scrubs helps maintain this sterile processing baseline. Trap analysis: option A is incorrect. While lint from clothing is bad, it doesn't primarily create static electricity that affects biological indicators. Option B is incorrect because facility scrubs are mechanically thermally disinfected during laundering, not chemically treated to continuously repel spores. Option D is incorrect because while comfort is a factor, the fundamental rule is based strictly on infection control and bioburden reduction, not just technician hydration. Concept extension: if a technician is cold in the prep and pack area, they must wear an approved, facility-laundered warm-up jacket, which must be snapped completely closed to prevent shedding. Question 5. Before beginning their shift, all SP technicians must remove watches, rings, and other jewelry. From a microbiology perspective, why is this infection control protocol strictly enforced across all sterile processing zones? A. Jewelry can easily scratch the stainless steel surfaces of surgical instruments and compromise their passivation layer. B. Jewelry creates microscopic crevices that harbor microorganisms and prevents effective hand hygiene procedures. C. The harsh chemicals used in the decontamination area will permanently melt or discolor gold and silver metals. D. Wearing jewelry violates the OSHA bloodborne pathogen standards dress code policy. Correct answer B. Knowledge point explanation. Core rationale: hand hygiene is the single most important factor in preventing the spread of healthcare-associated infections, HAIs. Rings, watches, and bracelets create dead spaces and microscopic crevices on the skin that harbor dangerous bacteria. These items block the mechanical friction of hand washing, allowing microorganisms to survive and be transmitted into or out of the SP work areas. Trap analysis: option A is incorrect because while scratching instruments is bad, the primary reason is infection control, not instrument maintenance. Option C is incorrect. Although chemicals can damage jewelry, the rule exists to protect patients from pathogens, not to protect the technician's personal property. Option D is incorrect because the removal of jewelry is an infection control standard driven by AAMI and the Centers for Disease Control and Prevention, CDC, not specifically dictated by the OSHA Bloodborne Pathogens Standard Stress Code. Concept extension. Similarly, artificial nails and chipped nail polish are strictly forbidden because they harbor fungi and bacteria in the subungual, under the nail, space, functioning similarly to jewelry as a bioburden trap. Question 6. An SP technician is assigned to the decontamination area to process a heavily soiled orthopedic set. According to the Occupational Safety and Health Administration, OSHA, Bloodborne Pathogens Standard, what is the primary clinical rationale for mandating the use of specific personal protective equipment, PPE, in this zone? A. To maintain the room temperature between 60 degrees Fahrenheit and 65 degrees Fahrenheit, 16 degrees Celsius to 18 degrees Celsius, for optimal technician comfort. B. To protect workers in biohazardous areas from occupational exposures to bloodborne pathogens when handling contaminated items. C. To prevent the transmission of transient flora from the technician's skin onto the dirty surgical instruments. D. To fulfill the facility's Environmental Protection Agency, EPA, requirements for medical waste disposal. Correct answer B. Knowledge point explanation. Core rationale. The decontamination area handles items laden with blood and body fluids. The primary purpose of PPE, fluid-resistant gowns, gloves, face shields, is to serve as a physical barrier, protecting the technician from dangerous bloodborne pathogens, as mandated by OSHA regulations. Trap analysis. Option A is incorrect because while decontamination is kept cool, 60 to 65 degrees Fahrenheit, PPE is not worn for thermal comfort, it actually increases body heat. Option C is incorrect because the instruments are already dirty. PPE is to protect the worker from the instruments, not the other way around. Option D is incorrect because PPE mandates fall under OSHA for worker safety, not the EPA for waste management. Concept extension. The OSHA Bloodborne Pathogens Standard also requires facilities to offer the hepatitis B vaccine to all at-risk employees at no cost within 10 working days of initial assignment. Question 7. During a routine audit, a supervisor observes an SP technician bringing a sealed bottle of water and a snack into the clean assembly work area. Why are food and beverages strictly prohibited in all sterile processing, SP, work areas? A. They can cause unexpected temperature fluctuations that exceed the maximum 73 degrees Fahrenheit 23 degrees Celsius limit for the prep and pack zone. B. The high humidity levels, up to 60%, in the controlled SP environment will cause the food to spoil rapidly. C. Food and beverages may attract insects, cause hands to become soiled, transmit bacteria, and risk spills that contaminate items. D. Technicians are only permitted to consume sterile water and prescribed liquid nutrition while actively working on the assembly line. Correct answer C. Knowledge point explanation. Core rationale. Infection prevention requires controlling all potential sources of contamination. Consuming or storing food and drinks in the SPD introduces severe risks. Spills can ruin clean packaging, crumbs attract pests, insects/rodents, and handling food contaminates the technician's hands with oral flora and bacteria. Trap analysis. Option A is incorrect because a small drink or snack will not alter the room's HVAC temperature parameters. Option B is incorrect because the primary concern is patient and instrument safety, not the shelf life of the technician's food. Option D is incorrect because absolutely no consumption of any kind is allowed in the active work areas, sterile or not. Concept extension. Staff must consume all food and beverages only in designated, unrestricted break areas that are physically separated from decontamination, preparation, and sterile storage zones. Question 8. The Environmental Services Team is reviewing the cleaning protocols for the Sterile Processing Department, SPD. To prevent the migration of microorganisms, how must the floors in all SP work areas be maintained? A. Swept daily with a dry broom and chemically disinfected every 48 hours. B. Vacuumed using a standard commercial vacuum cleaner at the end of every 8-hour shift. C. Wet mopped at least daily, and never swept or dust mopped to avoid aerosolizing dust. D. Scrubbed with a highly abrasive wire brush and concentrated bleach solution every 72 hours. Correct answer C. Knowledge point explanation. Core rationale: dry sweeping or dust mopping physically kicks up dust, lint, and microorganisms into the air, aerosolization. These airborne contaminants can then settle on clean instruments or sterile packaging. Therefore, floors must be wet mopped at least daily to safely capture and remove bioburden without launching it into the air. Trap analysis: option A is incorrect because dry brooms are strictly prohibited as they aerosolize dust. Option B is incorrect because standard vacuums exhaust air that can blow dust around. Only specialized HEPA-filtered vacuums are ever considered, but wet mopping is the standard daily requirement. Option D is incorrect because wire brushes damage flooring, creating crevices for bacteria, and bleach is not the universally required daily floor cleaner. Concept extension: cleaning implements, like mops and buckets, must be dedicated to specific areas. A mop used in the decontamination area must never be used in the clean assembly or sterile storage areas. Question 9. An SP educator is investigating an outbreak of surgical site infections linked to a contaminated orthopedic drill. To understand how the infection spread, they review the 6 links of the chain of infection. What is the correct sequence of these elements? A. Causative agent, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host. B. Bioburden, mechanical friction, chemical disinfection, sterilization, cooling, sterile storage. C. Pathogen, fomite, negative air pressure, biological indicator, sterile field, patient. D. Incubation, symptom onset, transmission, medical intervention, recovery, immunity. Correct answer A. Knowledge point explanation. Core rationale: the chain of infection outlines the specific sequence required for disease transmission. It starts with the microorganism, causative agent, its hiding place, reservoir, how it leaves, portal of exit, how it travels, mode of transmission, how it enters a new person, portal of entry, and the vulnerable person who gets sick, susceptible host. SP technicians aim to break this chain, usually at the reservoir or transmission links. Trap analysis: option B is incorrect as it lists the workflow of instrument processing, not the epidemiological chain of infection. Option C is incorrect because it mixes epidemiological terms, pathogen, fomite, with environmental controls, negative pressure, and testing devices, biological indicators. Option D is incorrect because it describes the clinical stages of a disease within a single patient, not the transmission pathway between individuals. Concept extension: a contaminated surgical instrument acts as a fomite, functioning as a mode of transmission, indirect contact, moving the causative agent from the reservoir to the susceptible host's portal of entry, the surgical incision. Question 10. A sterile processing, SP, technician is explaining the first link of the chain of infection to a student. Which of the following best defines a causative agent in a clinical setting? A. A person with a suppressed immune system who is likely to get sick. B. The specific microorganism, such as a bacterium or virus, capable of producing illness. C. An inanimate object like a surgical instrument that carries germs. D. The pathway through which a germ enters the body. Correct answer B. Knowledge point explanation. Core rationale: according to the chain of infection, the causative agent is the starting point. It represents the infectious microorganism, pathogen, itself. In the SPD, we aim to eliminate these agents through cleaning and sterilization to prevent disease. Trap analysis: option A describes a susceptible host. Option C describes a fomite or mode of transmission. Option D describes a portal of entry. They are different links in the chain. Concept extension: Common causative agents in healthcare include Staphylococcus aureus and hepatitis viruses. Question 11. In the context of infection prevention, a reservoir is best described as A. The surgical site where the bacteria finally settle. B. The place where the infectious agent survives and multiplies, such as contaminated instruments. C. The cleaning solution used to wash the hands. D. The administrative office of the hospital. Correct answer B. Knowledge point explanation. Core rationale. A reservoir is any person, animal, plant, or substance where an infectious agent normally lives and multiplies. In sterile processing, organic bioburden on dirty instruments provides a perfect reservoir for bacteria. Trap analysis. Option A refers to the site of infection, often the portal of entry. Option C is an intervention to break the chain, not a reservoir. Option D is irrelevant to the biological chain of infection. Concept extension. Effective cleaning is the primary method used in the SPD to eliminate the reservoir on medical devices. Question 12. Which of the following is a portal of exit in the chain of infection for an SP technician handling a soiled surgical tray? A. Intact skin on the technician's arm. B. Blood or body fluids on the contaminated instruments. C. The negative air pressure system in the room. D. The automated washer disinfector cycle. Correct answer B. Knowledge point explanation. Core rationale. The portal of exit is the path by which the agent leaves the reservoir. For contaminated surgical tools, the pathogens exit the reservoir, the tool, through the blood or infectious waste attached to them. Trap analysis. Option A, intact skin, is a barrier, not an exit for the pathogen on the tool. Option C is an environmental control. Option D is a method to kill the pathogen, not a natural part of the transmission chain. Concept extension. Standard precautions assume all portals of exit are potentially infectious. Question 13. What is the mode of transmission when a patient develops an infection from a scalpel that was not properly sterilized? A. Direct airborne transmission. B. Indirect contact through a fomite. C. Vector-borne transmission via insects. D. Endogenous transmission from the patient's own flora. Correct answer B. Knowledge point explanation. Core rationale. Mode of transmission is how the agent travels. In SPD, we are most concerned with indirect contact. A fomite is an inanimate object, like a scalpel, that carries the pathogen to the next host. Trap analysis. Option A is incorrect because the scalpel is a physical object, not a droplet or air particle. Option C involves living carriers like mosquitoes. Option D refers to infections caused by the patient's own bacteria, which contradicts the unsterile scalpel scenario. Concept extension. Breaking the mode of transmission is a primary goal of using barriers and proper instrument transport. Question 14. A susceptible host in the healthcare environment is defined as A. A technician wearing full PPE wearing a face shield. B. A patient who lacks the immunity to overcome the invasion of a pathogen. C. The surgical instrument that has been steam sterilized. D. The EPA-registered disinfectant used for environmental cleaning. Correct answer B. Knowledge point explanation. Core rationale. The final link in the chain is the susceptible host. Surgical patients are highly susceptible because their natural skin barrier is bypassed during surgery and their immune systems may be weakened. Trap analysis. Option A is a protected individual, making them less susceptible. Option C is a sterile object, not a living host. Option D is a chemical agent. Concept extension. Identifying high-risk patients, like the elderly or immunocompromised, helps the healthcare team prioritize infection control.